Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, everyone, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and back again. This is interesting because the last podcast you did with me is the one that's currently airing as we record this one right now, you rock stars.
We are becoming superstars, apparently. I don't know.
Totally. I think you're the first one that this has ever happened to that way, too. So you guys got that in your pocket. It is Dr. Jennifer Callahan and Dr. Bobbie Schneller who are in again to talk about the Family Medicine Residency clinic here in Rapid City. And I guess when it comes to staying healthy, it's really having someone in your corner that is going to make, I think, the biggest difference with what we're about to talk about here. Having a primary care physician can make all the difference, obviously. The first question that I want to ask both of you before we get into what the Family Medicine Residency is just starting with the basics. We have so many urgent cares that have popped up all over the area right now. Why is it so important to have a primary doctor?
Well, because it's the all-encompassing you, right? So our goal is to work on preventative care, so preventing you from getting sick, to keeping you well, so working on your individual wellness, which is really important. It's different for everybody. Screenings to try to catch things early, and then treating your chronic conditions. And so making sure that we're doing all of those things. So we're your first entry into the healthcare system when you're well. And that's important, is having somebody when you're well.
All right.
So like the urgent cares, let's say you go to an urgent care. When I got to go recently, my son broke his thumb. So we ended up in the urgent care because it was late in the day and our clinic wasn't open. So you go there for those acute emergency things when your clinic isn't open. For everything else, it's appropriate to go to your primary care provider.
Okay. Well, that makes total sense. It kind of was an obvious answer, really, as to why you should do that. But I think there are a lot of people, too, that just think, well, I'll just go to urgent care for, only for those moments. I'm not going to really plan ahead for my health to keep myself there. Just if I get sick, then that's where I'm going to go. All right. Now that question is kind of out of the way a little bit, I want to talk about the Family Medicine Residency, which is here in Rapid City. Give me the background of this, Jennifer, what it is, when it started. We're 30 years in now on this?
Yes, this year it'll be 30 years. So the Family Medicine Residency is a facility where doctors teach doctors how to do primary care. And it's a really cool place to be. Yeah.
So how did this all come about here in Rapid City?
Well, okay, so I know the history behind it.
Yeah,
I'll try not to bore you.
No, I'd love to know that.
So back in 1993, the state actually came to what used to be Regional Health, now Monument Health, and said we need more primary care doctors in our state. If you look at the state of South Dakota, it's a primary care desert. Most areas are underserved with primary care physicians, which means there's fewer than one primary care physician for every 3,000 people, I believe.
Here?
In South Dakota, yes. Rapid City, Sioux Falls, and right around Yankton are well staffed, but other areas of the state are not. And so they came to the facility, they worked with the state and with the federal government, and they developed this program to create primary care doctors. We know that doctors who train in medical school in South Dakota, there's a 50 to 60% chance they'll stay in the state of South Dakota. Doctors who do their residency training in South Dakota, 75% chance they'll stay here. Our graduates tend to stay in South Dakota in the surrounding areas, so we see some in Nebraska, some in North Dakota, quite a few in Wyoming. And so the goal is to keep primary care doctors who have the skills that we need in our communities here in this area.
So you mentioned earlier about doctors training doctors, right? What exactly does that mean?
Yeah, so when you graduate from medical school, you're a doctor.
Right.
Right, and you have all this training. But there's so much more to that. You have to have the experiences. So we were kind of joking before about the see one, do one, teach one.
Yes.
And so, that's how physicians learn, is hands-on training. And you get that here. So the Family Medicine Residency is a 3-year residency. So out of med school, you come here, and then you spend 3 years here seeing your own patients under direct guidance of faculty physicians.
Is this common across the country?
It's what medical training looks like. So you spend 4 years in medical school. The first 2 years are just book learning. And then you go and you stand behind physicians in different specialties and watch what they do. So that's your C1. And then you come into residency and we throw you into the deep end. You're seeing patients. patients and you're doing procedures and all of those things with a faculty physician, Dr. Callahan or myself, watching the entire time, ready to step in if there's any issue, reviewing every chart, making sure that patients are well cared for, but they're learning to actually become a physician. And then you go out in the world, and really physician means teacher, and you go out and you teach the next generation of physicians coming after you. And most of our graduates, I would say over 70%, either teach medical students, residents, nurse practitioner students. They do a lot of teaching. That's the role of a physician.
Did you guys do this too?
Yeah, absolutely.
Did you really?
Yes. Right here.
Long time
Did you do
ago.
it right here in Rapid City?
Yes,
You guys did the
both.
same thing.
Yes.
I graduated in 2009, and you were 2021, right?
Yep.
All right. That's that's very cool. I love just the whole local angle to it too, right? That you guys come here, do it here, you stay here, and you want to train what's next. And for everybody that's listening to the podcast right now, this isn't just a school for doctors. You can be seen here, right? This is a place where you can go to be seen with these doctors that are learning under doctors, right?
We have patients who have been with us for the entire 30 years. So
No kidding.
I still have patients that I took care of in residency who I see now.
Where are you guys located?
502 East Monroe.
Got it. Okay, good. I wanted to throw that out there right away. Now, and you guys do. You're not in urgent care. Got to make sure that's out there and everybody knows. But you guys do same day services as well, right?
Absolutely.
And that's lab work and X-rays and how does that change the game for you guys when you're doing this?
Every day we have same day appointments. So you call and you say, this urgent thing happened, I have this illness, whatever it is, and we try to get you in as soon as possible. Usually that's morning or afternoon, same day. And that's nice because you're seeing the same physician who cares for you when you're well. We also see you with the illness. And then, let's say you fell, you need an x-ray, we get that done, or you have lab work because you've been sick, we get that done same day.
It's frustrating when you can't see your primary care physician because they don't have any appointments because they're booked out for a month or two.
A long time.
And so we've recently just opened up these same-day appointments to make it easier for our patients to get in to see us when they need us.
Not too off the subject, but do you guys remember, because I'm amazed anymore when I go to see my primary care doctor and I have to have blood work done. There have been instances that by the time I've had the blood work done until I've gotten out to my car, I've had it pop up in my app with the blood work being finished.
Yes.
Yep.
That has had to have been a game changer for you guys in this field, how quickly now you can get results.
It used to be on paper when I was
Right.
I'll date myself. I used to have to run up to the floor and check the paperwork to see what the labs were. And so now, sometimes the patients will see it before we even get back to our computer.
Right.
And they're like, what's going on? Why haven't I heard from my doctor? So
Because you just call them. We're getting there. It had to go to space and back. Give us a second. It's I'm fascinated by that every time I go. How quickly you guys are able to turn that around, and I think that really should give patients confidence when they come and see you guys to know that because everything is we live in an instant society now, and I think medicine is getting more and more to that point. Your technology is amazing, and you guys, is this stuff you learn at this residency too? These are the exact same things that these doctors are training behind you guys with?
Absolutely, yeah. So our goal is that when you leave residency, you're going to be practicing like you were practicing in residency. So we're helping you practice the way you want to practice in residency.
Okay.
And really, Monument is leveraging the technology to train our doctors not to practice back in 2009 or even 2020. We have residents who are now using, and we'll meet with another one of our residents before too long, who are using AI to generate their notes while they're in the room so they can pay more attention to the patient. They go back and review the note that AI created, and it's there, which is so much easier than the way I did it, and much easier than the way you did it back in residency.
Well, and I love that. I was at a specialist here last week, and I saw on the door he had, this may be recorded. It's up front. They're telling you what's happening, and my first thought is I'm sitting there, I'm thinking, who is going to be mad about this? Because now it's all going to. But somebody's going to be like, well, I don't want you to record me. That's not the point. The point is so what you say, these doctors don't miss. And that's why AI, I think, is such a
And then
a
those
huge part of this.
recordings go away. But it's
Yeah,
one of those
exactly.
things where it used to be at the end of the day, you would dictate a note and you're trying to remember one of 20 patients you saw on that day and get all the details in. This is real time, and it allows our doctors to go back, and it gives them more of their time to focus on patients. It gives them more of their time back, their free time back in the evenings to go home and be with their families versus doing charting until the wee hours of the morning, which used to be a thing not that long ago.
I still don't know how you guys do that. I mean, your dedication to this type of profession is, I love what I do, but good heavens, you guys, you are dedicated to what you do. Now, for people who aren't familiar, though, what's kind of the difference between a resident physician and seeing a faculty physician?
Yeah, so a resident physician just means you're still in residency.
Okay.
So you're a doctor.
Explain residency really quick, though.
Yep. So residency, you guys will talk about it more in the
Yes.
next episode. But it's a time period for physicians, so you're a doctor, to perfect or improve on those skills that you need to practice.
Okay.
And so the resident physician is a doctor, not a student. That gets the most common thing that we hear.
They still think
and
they're...
then a faculty is someone who's already graduated from residency. So no one is overseeing what a faculty is doing or those
Okay.
kind of things. We still
They're
work
board
together.
certified.
Yep.
Board
Yeah,
certified.
I mean, everybody that you see at this clinic is a doctor.
Yes.
They are doctors.
Yes.
Right? There's no, well, he's almost there. Go ahead. Trust him. Okay. That makes total sense. And you guys, I think last time we talked a little bit, just kind of briefly touched on this, treating the whole person. And you kind of mentioned this at the beginning here too, when we got started on this. You guys obviously run into a lot of social factors around here in Rapid City. Housing, income, even transportation. You don't think that's a big deal around here? Because we always feel like everything's close. A 40-minute drive to us in the Midwest is, well, that's your neighbor, right? Mm-hmm. That's not a big deal. Mm-hmm. But for a lot of people, it can impact people's health, I think. Is that important in this practice with you guys too?
Absolutely, yeah. So our location of our building is intentional. A large number of our patients walk to see us. They don't have the transportation to come see us. And so that's one of the reasons why it's so important that we offer all the services that we offer, is because people walk there and they can get multiple things taken care of. We have a food pantry and the community closet. And so to be able to get those things all at once in one time, instead of making multiple trips other places or going other places to get things.
I never even, the location is really well located on Monroe Street there for sure. I never even thought about that. But yeah, nice job. Whoever did this 30 years ago.
We had nothing to do with it.
Now, you mentioned there's a couple of things I did want to talk about in here that I think are really unique to what you guys are doing. You did mention the food pantry. Mm-hmm. How did that come about?
Well, it came about when I was a resident. So
I was new program director. I'd been in the position about a year, and John Pierce, who was our vice president at the time, was in the process of becoming the president at the Rapid City Hospital, came over and said, "Hey, we have been approached by Feeding South Dakota, and there's about 4,000 families in your neighborhood that are food insecure, and we know that is bad for their health. Would you be willing to put a food pantry in?" And immediately we went, "How are we going to do that? Where would we do it? Who could staff it?" Yes, of course we have to do it. And so Mary Beth McClellan, who is our former nurse manager, she's still with us, but she's getting close to retirement. She spearheaded this. She became a certified food handler. She's been an RN for 40 years, but became a certified food handler. And we developed a space that met all of the requirements for a food pantry. Every patient who comes into our clinic should be screened for food insecurity. We should ask 2 questions of them. And if they say yes to either question, they're offered a trip once a month through our food pantry.
Now, let me just hold you up right there.
Sure.
Explain food insecurity just a little bit.
So if you have had difficulty securing food, or you have been close to running out of food in the last 6 months, that would be food insecure.
Got it.
And so you'd be surprised. I mean, it was eye-opening for us as doctors how many of our patients were really struggling to get food. And the food that is in our neighborhood, we have a lot of fast food restaurants. If you drive down East North, we have a lot of convenience stores, but really the closest place to go to grocery shopping would be Walmart, and that's about a mile from our clinic. Dr. Callahan mentioned that people walk to our clinic. That's a long walk to get food, especially if you have kids.
Well, and it's January. That's a
Right.
whole other thing,
And then carrying your groceries home.
Yeah, exactly.
And we've seen people do that throughout our neighborhood, like walk home from Walmart with carrying their groceries every couple of days. So,
Oh, man. What kind of need are you seeing specifically?
thousands of pounds of food a month have.
Yeah.
Yeah, the organization has been generous, the employees, and then we have some funding with which we can go get food from Feeding South Dakota and bring it into the food pantry.
Is there anything that just the general public can do for that?
Well, I mean, absolutely. I mean,
Okay.
you can donate
Yeah.
to the community closet or the food pantry. I don't think that we typically get a whole lot of donations from the general population, but Monument itself does a good job of.
Would you want more donations? I mean, or does that just add another layer of having to
Honestly,
organize
probably
things?
the easiest way to do it is to donate through the foundation.
Oh, okay.
Because we are one of the organizations you can donate to in the foundation.
Oh, well,
For
that's
supplies
good
for
to
our
know.
patients, which is sometimes easier than what do we do with the food. One of our big goals is, again, those unhealthy restaurants are very, very close to us. We try and bring in healthy food because the food that is cheapest is the worst for your diabetes, for your heart failure, your heart disease, and so we try and bring in some pretty healthy stuff. Occasionally we get some good cereals for the kiddos, and I learned a lot of things. There's shelf stable milk. You can have milk that is fine being out of the fridge, and we have some of our families who live in hotels, and so having shelf stable milk is a huge deal for those families. I didn't know it existed until we did this.
Well, now I've got new stuff I've got to look up.
we try and bring good
Shelf-stable milk. Huh. I guess I've never heard of it.
It was a new one for me too.
Okay. Now, you mentioned the community closet as part of this too.
Yeah.
So how did this come about, and what is it?
Well, when I was as a resident, you get continuity patients for obstetrics. So that means you see the patient for all their prenatal visits, you deliver the baby, and then you see the mom and baby after delivery as well. And so one of my first continuity patients, she lived off $300 a month. And she was excited to have a baby, but she didn't have any clothes. And so I came home and I told my husband, I'm going to Target and I'm buying this lady clothes. And he was like, yeah. And so I did. And I gave them to her. And when her baby outgrew them, she brought them back.
Oh, is that where the spark happened then?
And then I was like, why aren't we doing this? And so, yes, that's how it all started. It's donation. All of my children's clothes have gone through the community closet. But yes, it's essentially the very basics that you need to raise your children. And so it's mostly the little kids' clothes, but like, shampoo, lotion, baby wipes, diapers, those kind of things. And then, in the winter months, we try to get like coats and those kind of things. And it's grown a lot since then. Our homeless population is a big need that we try to fill as well.
Do you see this helping? Obviously, it helps with people who don't have it. But when people come in to see doctors, I'm trying to figure out the best way to put this. Does it help? Mentally, it must help, and that in turn must lead to them maybe taking better care of themselves a little bit?
Well, I think if you have to choose between diapers and food or clothes,
right.
I mean, it has to help in
Yeah.
some way, shape, or form. We did this poverty escape room and at the clinic, and it's an experience to learn how to do these things with the amount of resources you have. And the biggest thing that people were upset at was I'm running out of gas cards. Well, if you have to go from each stop, that's gas. Gas costs money. Well, you have to have money to buy gas.
Explain this escape room that you guys did. Who was involved with it? Doctors?
It's the Vukurovich Foundation does it. And they come in. We closed our clinic for a couple hours in the afternoon. We had our whole staff participate. And really it's just, you're basically given so many gas cards, which are your resources, and you have so many tasks you need to accomplish, getting your kids to and from school, getting to an appointment at WIC or the social services office, getting to pick up some groceries. And you're given this story that is a real person, and you're trying to maneuver this in a certain period of time. And really it shows you, we'll have 4 or 5 people, well-educated people who are struggling to make those resources stretch to accomplish all of the goals. And so it shows you how hard poverty is to navigate and gives you a little bit of an understanding. Now, we know that what we do for health is about 20% of what really matters in health. But if people don't have healthy food, they don't have access to clean water, they don't have the necessary hygiene items, that those things negatively impact health. And until we start helping with those things in healthcare, the other 20%, we are just we're not wasting our time, but we're not being as effective as we could be. And so we have to really look at the whole person and their situation they're in. It's really easy for me to say, yeah, I need you to add some baked fish and chicken and some healthy fresh fruits and vegetables. Go to the grocery store and buy that.
Yeah,
SNAP
no
benefits
kidding.
for a family of 4 are $140 a week. We have our residents actually go shopping on that $140 and try and feed a family of 4 and then reflect on it because it's harder and it changes.
Try to healthily feed a family of 4.
Yes, and it changes how they interact with their patients. It gives them a better understanding of how hard it is to make a dollar stretch and how hard it is for them to do the best things for their health.
Do you get some residents that come in that by the time they leave, they really you've seen a change in them? Just their eyes have been like open. They're like, I'm going to be a doctor. I'm going to help. I'm going to heal. This is what I'm born to do. And then once they leave, they're like, oh my goodness, there was a lot extra to learn in here about people.
Every last one of them.
I was going to say, if we're not doing that, then we're not doing our job.
Well, that's exciting. It has to be exciting when you see that.
Yeah.
When you see a doctor realize, yeah, it's not just about the medication. It's not just about the surgeries. Now I'm going to come in and I'm going to sit down and I'm going to get to know these people. And probably, like you said, for a long time.
Yeah.
Because people keep coming back and you keep working with these people and you get to see the moms and their babies, until, I don't know, they grow up and move on, I suppose, right?
And then bring their grandchildren.
And then bring their grandchildren back.
I'm not quite there yet.
Now, your clinic, this is growing, isn't it? Are you guys to a point where you're going to start to have to think about
We are actually.
expansion?
We're in the process
Is it happening
of that.
now?
So yes,
Okay.
we recognize we've had 18 residents in our program for 30 years, and a couple years ago we recognized we need more doctors in Western South Dakota. The rate the baby boomers are retiring, we need more doctors. So we petitioned our accrediting body and Medicare, and we got an additional 6 spots, 2 per class year. So this year we'll have 22 residents. We just matched a whole new class of residents. They'll be coming in June, and eventually next year our goal is to have 24 residents instead of 18. So with that, we are expanding to the other side of our building, which has been vacant for 10 years now, adding new staff. We just had a couple start today, so that's really nice, expanding the lab a little bit. It's been very, very busy over in our clinic for the last couple of years.
Now, maybe the one question I haven't asked with all of this, too, that somebody may be thinking about. At a clinic like this, where it's doctors training doctors, and you can actually schedule appointments to have a doctor you go see, how is that different from just a normal, I don't want to say normal, that's not the right word. How
We're
is
not
that
normal.
different? There, you said it. No. How is that different from seeing a primary care doctor that's already has their own,
Well, I think you get an extra set of eyes. You get another mind to think about you, and I think that really benefits the patients. All my family goes to the residency.
Mine too.
Boy, that's an eye-opener. See what I did there? No, I didn't mean to do that. But no, you're right. So when they're in the room with the doctor, the resident is always in there as well?
So the resident physician is
the doctor,
is
and
the
then
doctor.
the
and
faculty, which is you,
Yep.
I learned.
We're in, correct, are in a different part of the building.
Okay.
And so if there's anything that they have questions about or they want us to look into, they come and talk to us. We have a discussion. And sometimes then we go see the patient, like, I've never seen this rash before. Would you go look at this with me? Or what do you think this is? Because medicine is complicated. And
Yes.
people don't fall on an algorithm. And then anytime there's a procedure, we're in the room for the entirety of the procedure, either assisting or helping in any way that's needed.
Well, now can surgeries happen here too?
Minor surgeries,
Minor,
so like
okay.
skin procedures.
Oh, got it. All right.
We do implantable birth control, IUDs and Nexplanons, stitches. If your kid cuts their finger,
Right.
we can split someone and get them over to the orthopedic docs if we're open. My kiddo, we missed it by like an hour.
All right. So, what do you guys kind of want to have people take away from this when it comes to what you do? Like, doctor, what do you want people to really think about when it comes to this residency?
Yeah. So, primary care, the goal is for us to help you in all aspects of your life. Our goal is to see you when you're well, to help prevent you from getting sick. And it's personalized medicine. It's about you. It's not about anybody else. And in the residency, you're going to get 2, 3, for the price of one.
Yeah. Okay. Is that how you feel too, Doctor?
Absolutely. No,
right.
it's all about taking care of those patients for their entire lifetime. The residents graduate, the faculty stay, and it's a great job.
It is. It's like you're
it's fun.
teachers, and you get to see the kids grow up and go out into the world.
Oh, it's the best part of my job when they're ready to go do their work. It's so
Exactly.
great to see. It's like watching your kids grow up.
Yeah,
a little bit,
it is totally. Do you guys see yourself doing this then for as long as you can?
Yeah. And the other point that we didn't necessarily say outright is that, when you are sick or when you have something, we help coordinate that care. We get you to the right specialist. If you have to be in the hospital, we're going to see you in the hospital. And then we're going to see you after the hospital.
Yeah.
And so that kind of coordination and continuity of care is really important to us too.
I think that's the biggest change in healthcare that's going to make the most difference is just the ability for doctors to have time now. I've noticed it with my own. It's nice to be able to not feel so rushed when you go in there if you've got questions.
We do not want to stare at a computer screen. That is not why we got into this. We want to talk to the patients
Right.
and have those discussions. That's the fun part for us. The computer is just something we have to
You have to do.
Yes.
Well, and pretty soon, I don't know, AI might be doing even more of that
There
for
we
you,
go.
hopefully.
We're good with that.
Yeah, exactly. Family Medicine Residency, Dr. Bobbie Schneller and Dr. Jennifer Callahan. Again, thank you guys for coming in and doing
Thanks
this.
for having us.
And, let's find something else that you guys are doing that's cool to talk about next time. We'll try to schedule it again with the podcast as it airs. 'Cause you guys are great. I appreciate it. Thank you for coming in.
Thanks
Thank
for
you.
having us.